Hello, and welcome to the HUD broadcast on the Continuum of Care duties related to planning and system operation responsibilities for the Continuum of Care. My name is Susanna Limon. I am joined today by Tiffany Moore. We are HUD Homeless Program Specialists in the Office of Special Needs Assistance Programs, or SNAPs. We will review the CoC duties and requirements under the new Continuum of Care program. While this broadcast provides a brief introduction on this topic, as always, we encourage you to seek complete information on the CoC program regulation at 24 CFR 578. We will start today's broadcast with an overview of the purpose of the CoC program. Then we will walk through the planning and system operation responsibilities assigned to the CoC in the relevant regulations, so listeners can clearly understand what will be expected of their CoCs. Tiffany?
Let's start with an overview of the purpose of the CoC program. The CoC program is designed to 1. Promote a community-wide commitment to the goal of ending homelessness, provide funding for efforts to quickly rehouse individuals and families who are homeless, which minimizes the trauma and dislocation caused by homelessness, promote access to and effective use of mainstream programs, and finally, optimize self-sufficiency among individuals and families experiencing homelessness. The planning and system operation responsibilities assigned to the CoC recognize the extensive coordination required to achieve the purpose of the CoC program and the need to have a clear lead entity accountable for these goals.
Under the CoC program, CoCs have 4 specific planning responsibilities. The first of these is the development of a plan for a coordinated housing and service system that meets the needs of individuals, unaccompanied youth, and families experiencing homelessness. At a minimum, the system should encompass outreach, engagement, assessment, shelter, housing, supportive services, and prevention strategies.
The second CoC responsibility is planning and conducting a point-in-time count of unsheltered and sheltered persons who are homeless that meets all requirements established by HUD. The CoC is also responsible for conducting an annual gaps analysis of the homelessness needs and available services in the continuum. HUD has historically awarded more points to CoCs that conduct an annual sheltered point-in-time count. Another CoC planning responsibility includes working with the Emergency Solution Grant recipients and consolidated plan jurisdictions within its geographic boundaries. The CoC also provides information to inform the consolidated plan, develop a plan for allocating ESG program funds, and reports on and evaluates the performance of ESG program recipients and subrecipients. Given that funding under the CoC program is insufficient to support a comprehensive system for addressing homelessness, additional funding from dedicated homeless programs, including ESG and mainstream resources, is needed to carry out a CoC's homelessness activities. Coordination of these funding streams and related services lead to a stronger community response to homelessness.
In addition to the planning responsibilities that Tiffany described, the CoC program interim rule assigns 4 responsibilities to the CoC associated with operating the CoC's homeless system. Combined, these responsibilities provide a mechanism to ensure the CoC's plans are effectively translated into practice. In the past, many of these responsibilities were implicit through the annual application process, but some of them are new. For example, the requirement to establish and operate a coordinated assessment system and to establish and consistently follow written standards for providing CoC assistance will probably be new to most, if not all, CoCs. Let's talk about each of these requirements in more depth.
Under the CoC program interim rule, CoCs are required to have more accountability for the performance of the recipients and subrecipients. First, in consultation with recipients and subrecipients, the CoC is responsible for establishing performance targets appropriate for population and program type. The CoC is then responsible for monitoring recipient and subrecipient performance, evaluating outcomes, and taking action against poor performers. Note that taking action doesn't necessarily mean to take a punitive action. Rather, the CoC could provide poor performers with technical assistance and require improvement plans as a means to strengthen the overall system, rather than let poor performance continue unchecked.
The performance measurement responsibility is instrumental to inform system planning and to benchmark whether the CoC's resources and services are being coordinated in a way that moves the CoC toward its goals for ending and preventing homelessness, and that the CoC is accountable for its funding decisions. The Hearth Act establishes clear system performance measures that the CoC should use and will need to report to HUD.
The CoC has the responsibility of measuring performance at the system level and the project level, including outcomes of projects funded under both the CoC and ESG programs. This requirement is in place to take action against poor performers, but the CoC will report to HUD on all of them.
The last two operational responsibilities of the CoC center around coordinating the housing and services available in the geographic area of the continuum. This will be a substantial new requirement for many CoCs, especially since it requires collaboration with the ESG recipients in the CoC's geographic area. First, the CoC must collaborate with the recipient of ESG funds to establish and operate a centralized or coordinated assessment system. The purpose is to have a standard approach to comprehensively assess the housing and service needs of individuals and families when they initially seek help. The coordinated assessment with the system-wide performance targets is necessary in order to meet the federal strategic plan goals.
Some communities created coordinated assessment systems as a part of the implementation of the Homeless Prevention and Rapid Rehousing Program, or HPRP, while other communities' systems predate HPRP. Whether a community is creating a new system or relying on an existing system, the coordinated assessment system must be established and operated in collaboration with ESG recipients, cover the full geographic area served by the CoC, which can be a regional geography, be accessible to individuals and families seeking housing or services, be well advertised, use a comprehensive and standardized assessment tool, and meet other requirements established by HUD.
The CoC must develop a policy that guides consistent operation of the coordinated assessment system with respect to how the system will triage and address the particular safety needs of individuals and families who are experiencing homelessness. The policy must state how the system will address the needs of individuals and families that are fleeing or attempting to flee domestic violence, dating violence, sexual assault, or stalking, but who are seeking assistance from non-victim service providers.
Finally, CoCs are required to work with ESG recipients to develop written standards for providing CoC assistance. These must include standards for determining who is eligible. This is merely beyond the minimum HUD regulatory requirements for housing resources, such as transitional housing, rapid rehousing, and permanent supportive housing. CoCs must decide the amount or percentage of rental assistance that a rapid rehousing participant should receive, and similarly, the amount they should contribute toward their rent. The CoC should also help ESG and CoC recipients and subrecipients to apply those standards through the development and implementation of consistent policies and procedures. The CoC must develop additional standards related to administering homelessness prevention assistance if the CoC is designated as a high-performing community. HUD is not issuing national standards through the regulation. Rather, we want CoCs to identify their own standards.
Let's just take a moment to summarize all the planning and system operation responsibilities that the CoC is required to take on as part of the CoC program. If you look at the slide, you'll see on the left are the planning and on the right are the system operations. One of the major changes under the Continuum of Care program interim rule is the availability of funding to support some costs related to implementing these CoC responsibilities. Eligible CoC planning costs include the cost of developing a community-wide or region-wide process involving the coordination of all relevant CoC stakeholders, determining the geographic area that the Continuum of Care will serve, developing a Continuum of Care system, designing and implementing a centralized or coordinated assessment system, evaluating the outcomes of projects for which funds are awarded in the geographic area, including the Emergency Solutions Grants Program, participating in the consolidated planning process of the jurisdictions in the CoC's geographic area, preparing and submitting an application to HUD on behalf of the entire Continuum of Care membership, and this includes conducting a sheltered and unsheltered point-in-time count and other data collection as required by HUD,
and monitoring recipients and subrecipients and enforcing compliance with program requirements.
Thank you for joining us for this broadcast on the CoC's duties and responsibilities required of the CoC in the CoC program regulation. Please refer to the related training materials on the CoC's responsibilities in establishing and operating a continuum of care that are provided on the 1CPD Resource Exchange. In the event that you have a specific question, please contact your field office or submit a question to the Ask a Question section of www.1cpd.info. As a reminder, this broadcast provided a brief introduction on this topic. As always, we encourage you to seek complete information on the CoC program regulation at 24 CFR 578. Thank you.